Hello, my name is Kaylee Zapata and this is my video assessment number 2 of the lungs, cardiovascular, and abdomen. For my assessment of this patient, I'm assessing a 27-year-old male. So the first thing I'm going to do is inspect the anterior and posterior portion of the thorax. Respirations are present and visible. Male hair pattern is appropriate to his pattern. It's equal on both sides. I do not see any visual abnormalities, meaning no macules, no lesions, no scars or lacerations present on the anterior side. And can you lean forward for me? And there are also no areas on the posterior side. The next thing I'm going to do is check for thoracic expansion. So Emmanuel, can you please lean forward for me? And I'm going to place my hands around your 10th rib and take a deep breath for me. Okay, and thoracic cage expansion was present. Alright, coming back. And now I'm going to feel for any bulges, masses, or tenderness or any lesions. Any pain at all when I'm pressing?
No.
Okay, great. The next thing I'm going to do is percuss in the back side. So I'm going to turn you to the side and I'll have you lean forward for me. And I'm going to percuss in the lung areas. Okay, and I'm listening for any dullness or resonance. Dullness is good, resonance means there could be fluid in the area. Okay, good, and you can lean forward for me. Thank you. And the next thing I'm going to do is measure chest thoracic expansion. So again, sorry, I'm going to turn you to the side, have you lean forward. And take a deep breath in for me and hold it. Hold it. Okay, and I'm going to mark. Alright, and you can breathe normally. Exhale for me. Good. Alright, and again, this time I want you to take a deep breath in, exhale, and leave it out, and just keep your breath exhaled. Breathe out. Alright, and I'm going to measure that area. Okay, and it's at 6 centimeters, which is appropriate. Okay, and now I'm going to be listening to lung sounds. Just breathe normally for me, okay?
Okay.
Okay, and I'm going to turn you around. And I'll have you put your hands up on your head for me. Okay? Good. You're going to breathe normal. Perfect. Okay. Okay, and you can lay your hands down by your side. Okay, good. And I did not hear any adventitious lung sounds during that assessment. So the next thing I'm going to be doing is assessing for tactile fremitus. So I'll have you lean forward for me. And I want you to just say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Okay, and tactile fremitus was symmetrical and vibration was felt on the ulnar aspects bilaterally. Next thing I'm going to be doing now is moving on to the cardiovascular assessment. And with this assessment, the first thing I'm going to do is just visualize the cardiac area. So I'm looking for any heaves, lifts, or thrusts. And I do see, I'm able to visualize pulses in the apical area. So the next thing I'm going to do is auscultate to the 5 areas of the cardiac sounds. So the first area I'm going to look at is the aortic area, which is to the right of the sternum in the second intercostal space. The next area is to the left of the intercostal space of the sternum in the second intercostal space, and this is pulmonic area. Next is Erb's point, which is the third intercostal space to the left of the sternum. The next is the mitral valve, which is the fourth to fifth intercostal space left of the sternum. The next is going to be apical, which is the fifth intercostal space. Alright, great. And there were no murmurs auscultated. The cardiac sounds were regular and normal, and within normal limits of 60 to 100 beats per minute. And again, no murmurs were auscultated. The next thing I'm going to do is palpate for peripheral pulses. I'm going to start with the temporal. And brachial is next. And the next is radial. And all pulses seem to be present, bounding and equal, and easily palpated. Next is going to be popliteal, so I'm just going to hold your hands. And this is right behind the knee. Okay, popliteal is present on that side. Okay, popliteal is present on that side as well. Next is posterior tibial. And the final one is dorsalis pedis. Okay, and that is present. And I would check it on the other side as well. And those pulses are present. The next thing we're going to be doing is the abdomen, so I'll have you lay down on the bed. Just lay down right here, like that way. No, other way.
Other way?
Look on your belly. Yeah.
Like this?
No, on your side.
Oh, on
your
my side.
back. Not laying. Yeah. Okay. So for this, the first thing we're going to do is the first thing we're going to do is just inspect the abdomen, and I'm going to visualize the abdomen that there are no striae, no irregular vascular patterns, no vascular patterns present. The umbilicus is inverted, the shape is round and it's symmetrical, and there is visible pulses, but no peristalsis. So now I'm going to put down my, and I have to scan the room to make sure that there's nothing hanging up on the wall. So the next thing I'm going to do is my hands-on abdominal assessment. So the first thing after inspection is auscultation. So I'm going to auscultate the bowel sounds in all 4 quadrants, and do that now. And bowel sounds are present, and respirations are present in the abdomen as well. The next thing I'm going to do is listen over the organs, the liver and the spleen for any organ friction rub. You listen over the liver. No friction rub heard. Over the spleen. No friction or hurt. The next thing I'm going to do is listen over the arteries.
You want me to hold it?
Yeah. Can you see it?
Yeah. Where do you want?
That just over. So I'm going to listen over the renal arteries. Iliac. And femoral. Okay. And there are no bruits heard. Are you still doing with that? Are you good with that? Keep doing that. So the next thing I'm going to do is percuss over the abdomen. And over the bladder. Alright, and the next thing I'm going to do is palpate the liver. So, what I want you to do is take a deep breath in for me. And out. Okay, and cough. Alright, and the liver appears smooth. Next thing I'm going to do is measure and percuss. So I'm going to go from dullness to tympany. And then resonance to tympany. Okay, I'm going to measure that. And it's measuring at 8.5, which is normal in size. And the next thing I'm going to do is palpate for the spleen. And the spleen should be nicely tucked up under the rib cage on the left side. Any pain?
Oh.
And the spleen is not palpable. That is it for my abdominal assessment. I'm just going to do one other step in palpating the kidneys. So the kidneys can be palpated retroperitoneal. So just lay still and they're not always as easy to palpate on a person, and if they're thinner it is easier. Okay. And the kidney, is it pain at all?
No.
Okay. Alright, and just again lean against me. Any pain?
No.
Okay. Alright. So the kidneys are palpable, there are no nodules, there are no rigidness. The patient didn't complain of any pain upon palpation. That is completing of my lungs, cardiac, and abdomen assessment. Thank you.